The following segment is sponsored by Pinhole Academy. We all worry about how white our teeth are, but many of us don't think twice about how healthy our gums are. And receding gums can be a big problem that you put on the back burner for years. But luckily, this man right here has the answer. This is Dr. Theurer, the Sugar House dentist. Thanks so much for joining us.
Hey, thanks, Brooke, for having me today.
All right, so let's talk gums. And I'm going to be the first one to admit, I don't really think about my gums until they start bleeding or hurting. And I think that's the truth for a lot of people. But receding gums is a big problem, and it can actually lead to tooth loss even. It
can. It's one of those things that can creep up on you, and you're not aware of it until all of a sudden you may have a symptom. You may have some pain, some sensitivity, and then you're seeking out some sort of solution. And tooth loss happens because you lose the bone as you lose the gum tissue. And if you lose bone around your teeth, all bets are off at that point.
Well, you only get one set, so you got to make sure that they last,
exactly right? Yep.
But the good news for us is that you have a breakthrough treatment that is less invasive for us. Let's talk about the Pinhole Gum Rejuvenation.
So the Pinhole Gum Rejuvenation technique was a technique that was invented by Dr.John Chao a number of years ago, and he has trained over 3,000 dentists worldwide at this point to do this technique. I just so happened to be lucky to fall into a conversation with Dr. Chao about this. I'm always looking for new ways to help my patients, and Dr. Chao's pinhole surgical technique was the perfect thing for us to do to address this issue. So I was one of the first 3 dentists trained in Utah to do this technique.
So you know what you're doing. We're looking at this right now. So describe how this is helping our gums here.
So what we're doing here is we're repositioning the gum tissue using a very minimally invasive technique of just pushing the gum tissue into position and then holding it in the position with collagen. Typical gum tissue recession is taken care of this way. What you're seeing now is you're seeing incisions and stitches, and what we're doing differently is we're being minimally invasive in this situation. Patients' responses are much less pain, a real quick healing time, and patient satisfaction overall is much better with this type of technique.
Well, that gum grafting looks painful, just even in the animation. I don't even want to see that person's eyes as they were doing it. And everyone gets a little nervous when they go to the dentist.
Sure.
We were talking about this before, about how somebody's smile can really impact, and you can see these in these before and afters. Imagine walking out with that brand new smile, and you actually did this procedure,
Absolutely. I did do this procedure. This was a patient a couple years ago, and the top is the beginning, and then at the end we did this in concert with some orthodontics and a wonderful orthodontist, John Graham, in our community. But this patient, she came over 2 hours to see us because she heard about this technique from Idaho, and this is a wonderful example of what we can do for a patient in framing their smile, because that's what the gum tissue really is. It's the frame to the teeth.
Imagine smiling and not being self-conscious anymore after you have been that way for years. So if somebody's watching at home right now and they've been dealing with this issue, how can they get a hold of you? How can they get those pearly whites back on track?
Well, you've got the number here on the screen. You can go to askyourdentistaboutpinhole.com. You can also go to Gum Recession Salt Lake and find a dentist that you are looking for that does this particular type of treatment. You can also call that number 626-308-9104 and find a dentist who's specifically trained in this procedure.